Kibra, Nairobi. An informal settlement housing 185,777 people, according to the census conducted last year. This is the newest COVID-19 focal point, with Health Cabinet Secretary Mutahi Kagwe announcing 35 new cases today.
The distribution in Nairobi is as follows. Kibra, 35 persons. Langata, 15, and that's near Kibera as well.
The 35 cases in Kibra among the 147 new cases reported today from a sample size of 2,831 people. 2 weeks ago, a positive patient who interacted with Kibra residents near Toy Market died in Bomet County. The patient was treated in one of the health facilities inside Kibra before he was taken to Longisa Hospital in Bomet, where he succumbed. That was the first attention-grabbing case from Kibra, which now has more than 90 COVID-19 cases in the last 7 days. 14 cases were reported in Kibra yesterday, while 6 cases were reported on Tuesday. From Wednesday last week to Monday, the 25th, a total of 36 cases were reported in Kibra, with a total of 91 positive cases in the last 7 days.
I would also like to urge that there should be no stigmatization of individuals who have tested positive. I have said, and I repeat, there is not a single person who is safe from getting or becoming COVID positive. Anybody can get it. You can get it, I can get it. And we have said this over and over again.
Nairobi County today reported the highest number of infections, with Mombasa County recording 41, Kiambu 3, with Nyeri County joining the list of counties with COVID-19.
We cannot really have everybody, being where they are by force. Because, as I have said, there are countries where they don't even have quarantine facilities because people quarantine themselves at home.
Other than Kibra in Nairobi, Langata, Makadara, Embakasi West, Kasarani, Dagoretti North and Kamukunji also continues to record high COVID-19 infections, even as the Health Ministry routes for targeted mass testing in areas identified as hotspots. A greater challenge now is the shortage of reagents, tying the government's hands in conducting more tests.
And at the moment, those reagents are in great demand across the whole world. So what the limiting factor is actually the testing reagents, not the machines, because unfortunately or fortunately, the way some of those machines were made is such that you can only use reagents of that machine from one specific source. And those sources are generally in the United States and Europe. And as you well know, they had stopped the exportation.
To bridge the gap, the ministry has embarked on strict targeted mass testing around estates neighboring those recording high COVID-19 infections. In Ruaraka, hundreds of residents stand up for the tests, with the neighboring Mathare having recorded 34 cases in under 48 hours. With the number of positive cases in the country rising rapidly due to targeted mass testing, the Ministry of Health is now calling on county governments to intensify their preparedness in hospitals should there be a surge in numbers. Stephen Leto, Citizen TV, Tigoni Hospital, Kiambu County.